Hello everyone, welcome to AIxGov, the panel on introducing AI, the new clinic assistant. I'm Ming En, a reporter at GovInsider, and I'll be your moderator for this session. Stay tuned for an exciting 60 minutes ahead, as our panelists will discuss how AI can reduce the manual and human workload, whether it's by speeding up x-rays, answering phones, or predicting illnesses. Joining us today is a panel of AI and healthcare experts, including Dr. Fu Zhiyan, the Principal Specialist of Data Analytics and AI at the Integrated Health Information Systems, or AIxGov Singapore. We also have with us Associate Professor Tan Che Heng, the Executive Director of the Centre for Healthcare Innovation, Singapore, Setiaji, the Chief of the Digital Transformation Office in the Ministry of Health from Indonesia, as well as Javed Ali, the Industry Practice Director of Healthcare from UiPath. We also want to thank UiPath for making this session possible. And without further ado, we'll jump right into the session with a presentation by Dr. Fu, who will be sharing on how AI is being used to treat diabetic patients with chronic kidney disease. Dr. Fu, please.
Hello, everyone. This is Jian. Can we go to the next slide, please? Yeah, first, let me introduce our company, AIxGov. Growing and aging population make healthcare demands grow in scale and complexity. AIxGov is the largest health tech company in Singapore. Our mission is to digitize, connect, and analyze. We are also one of the funding company for AI.SG. At AIxGov, we design, implement, and support a wide range of large-scale IT solutions. From health analytics to mobile apps, we practically touch almost every aspect of health tech. One of our famous projects is the pharmacy automation system, where we use the robots to package medicine for patients. This not only increases our productivity, but also improve patient safety. Next slide, please. In our department, we support MOH and public hospitals with analytics to deliver at scale from insights to actions. We engage our stakeholders to understand their business requirements and then translate the requirements into AI projects. We then can do exploratory analysis, dashboarding, machine learning model development, all the way to model deployment and integrate the models into healthcare system. In the following, I will show one example of our work. Next slide, please. National Diabetes Database, or NDD for short, was jointly developed by MOH and AIxGov to support MOH's War on Diabetes strategy. Through the War on Diabetes strategy, what we want to achieve is to discover new insights and have a national level view of diabetic situation in Singapore. Develop the healthcare program and enroll patients into the program. However, prior to NDD, diabetic cohort and data sit in silos because hospitals have their own diabetic registries. For example, CGH has their own registry, SGH has its own registry. Even in the MOH level, they also collect the diabetes information through administrative data. This data may be inconsistent or may be overlapped because they are from different sources and using different criteria. Through our NDD project committee, we standardize the criteria and consolidate the data from existing systems across the entire nation. Above the database, we also develop dashboards to let users have overview of the information in the database. The Diabetes National and AIxGov dashboards was launched in 2017 to provide a national and regional view on diabetes population and their related indicators. Next slide, please. Now let's move on to the chronic kidney disease, or CKD. Chronic kidney disease is major complications concern for diabetic patients. Based on the previous report, 2 in 3 of new kidney failure cases are due to diabetes, and it is a major disease burden in Singapore. The key to prevent the kidney failure is to identify the high-risk patients and have early interventions. Therefore, a national HOT-CKD program was established to prevent and slow down the deterioration of CKD. So there's synergy between the HOT-CKD and the NDD program to support CKD management for diabetic patients. Next slide, please. We work closely with HOT-CKD clinicians to determine how to use an NDD and AI to help. We propose a few predictive AI models. One of the models was prioritized by the HOT-CKD committee as a decision support tool for polyclinic clinicians in managing diabetic patients. The project starts from using NDD as data source and identify the early stage CKD patients, CKD stage 1 or 2 patients as the cohort. And then we use this cohort and data to develop an AI models to predict if the patient will progress to CKD stage 3 and above in the next 5 years. The output of the model is the risk that the clinician can use as a decision support. I will explain how the polyclinic clinician can make use of it later. Next slide. We have done some literature research and found some similar models. We compare with our models with other published models in our cohort. The first model on the left side, we call it clinical models because the clinicians use eGFR to diagnose CKD and also use it to predict the patient's future outcome. So we apply it into our cohort. The performance in terms of AUC is 69%. The second model in the middle is one of the well-recognized published model. They use a statistical method called cost regression. We apply it in our cohort and use the same variables that they use. The performance in terms of AUC is 81%. The last model on the right side is our AIxGov model. We use machine learning approach and add more variables that's suggested by the HOT-CKD clinicians. You can see our model performed the best with the AUC in the excellent range. Next slide, please. We also work with the polyclinic clinicians across the nation to run a clinical validation study. Before that, we already proved to the clinicians via technical validation that our model is stable, robust, and our performance can maintain the same excellent performance when we apply to new cohorts. For this clinical validation study, the objective is to analyze the concordance of the clinician prediction versus model prediction in order to determine the utility of our AI model in the polyclinic practice. To do that, we generate a new clinical validation cohort, which we don't have the access before, and provide it to 20 polyclinic clinicians across 3 healthcare clusters to predict the patient's CKD progression. And then we compare their predictions versus our AI model. The results is shown in this plot. This is called the ROC curve, where the y-axis is the sensitivity and the x-axis is the 1 minus specificity. The dots in the middle represent the clinician's prediction performance. The blue curve represents our model performance. First of all, you can see that the predictions by the clinician vary across institution clusters and their seniority level. Some clinicians did better than others, but our model outperforms any clinician subgroup. As you can see, all the dots are under the curve. The area under the curve, which is the AUC I showed in the previous slide, is in 88%, which is consistent with our technical validation result. Our model predicts more accurately than the clinicians. We presented these results to the HOS CKD committee, and our model was endorsed by. Next slide, please. So in this last slide, I want to show how this AI model can be used to support the HOS CKD program. So in the left side, this is the workflow without the model. The early stage CKD patients, which is in the CKD stage 1 and 2, was enrolled into the HOS CKD program. There are phase 1 and phase 2 intervention. On the right side, we can show that what happened after we include the AI model. So our intervention could be more targeted. For example, during the phase 1 intervention, the high risk and very high risk patients identified by the model can have a further drug therapy intervention, such as more frequent drug titration. In the phase 2 intervention, which is more resource intensive, we can work with the HOS CKD program to select the very high risk patients for lifestyle modification. Thank you. That's all.
Thank you, Dr. Fu, for the insightful sharing on how AI predictive models can be used to treat and manage chronic kidney diseases in diabetic patients. I'll now be handing the time over to Javed Ali, who will be presenting on automation in the healthcare sector. Javed, please.
Thank you. Hi, everyone. So let's start and look how the automation is actually helping by embedded AI ML capabilities within the robotic solutions, how these solutions are helping the hospitals in the healthcare sector. So if you see the focus area from the hospital's point of view, so we know we are serving the patient. We want to serve them in a way that they can get the quality care, and we have all the capabilities available for us which can help to provide that quality care to bring the better outcome from the patient's treatment point of view. And how we can achieve that. So basically, when somebody is some patient is looking for the treatment, what are the different ways or what are the different aspects from him? How we can or onboard those patients quickly, how we can assist the physicians, how we can have their smooth onboarding, look into different systems, validate their information, and then post all those information into the required system. How once the patient is going through the treatment, how we can monitor those care services, and at the time of discharge, what are the requirements, what are the different steps which we need to take care, and how the smooth discharge can be possible. Okay, can we have the next step, please? Okay. So from onboarding point of view, to bring the better outcome, the next step is basically how that treatment or that service can be improved by providing the assistant to the physicians. So basically, when the patient is in the hospital, the physician would go through the treatment and then provide whatever are the requirements there. They look into the patient's past history, and based on that, they can provide the treatment. Now, how that past history can be available, and in these days, we have seen after the COVID, the growth in the telehealth is huge these days. So more than 40% of the growth we have seen within the telehealth services. So currently best way is basically when we have onboarded a patient, how the patient's past history would be available for the physician so that they can see what type of treatment these patients have taken in past, what were the vitals and how those vitals are behaving right now. So those information can be gathered and can be provided to the physician so that they can take the better decision and they can provide the best in class treatment for the patient. Okay, and how all these how these capabilities can be achieved. So when we are looking into to guide the patient, physician for the past history, we need to gather the information. So we need to, so information for the patients are in the different system. How that information can be gathered. So there are robots which can help the physician or which can help the to gather all those information, access those silos information. It might be structured or it might be unstructured. In case of unstructured, those information can be formatted, and after formatting, those can be posted into required consolidated. So there are robots actually which are actually looking into different system at the real time as well as in the scheduled way. So they can gather the information, they can extract information from the documents, so that unstructured information can be formatted into structured and then can be provided for the training purpose for the AI ML algorithms. Now, when we are looking to AI and ML or intelligent solutions within healthcare, how those can be achieved, what is the role of the RPA, which is bringing or which is helping to have those solutions. So first of all, I mean, one of the main areas is basically gaps in care. As I mentioned, that how we can bring the information for the physician so that they can take the best in class decision for the patient's treatment. And for that, information need to be gathered, information need to be in connected way, not in the silos. So for that, the gaps in care is one of the area where a big time I mean investment is going into this area, and now the robots can gather that information quickly and can provide or help with the recommendation to the physician to take the best decision for the treatment for the patient. Telehealth is basically, we have seen after the COVID, this is one of the healthcare area which is having the big time increment in the day-to-day activities from the telehealth point of view. Now, more than 40% of the initial discussion is being done through the telehealth directly. So for that purpose, now then again, when somebody is taking care for a patient and providing the consultation, how they would be able to get help from the AI and the robot. So basically, the information can be gathered from multiple systems and then can be structured in a way that the physician who is providing consultation to the patient can take the help of that available dashboard or the information and can provide the required details or consultation to the patient. Now, again, how these advanced technologies, so let's say we are having chatbots, we are having conversational bot, we are having other platform, all these platforms are helping to the patient. So basically, and I mean, IoT, let's say Alexa and other devices through which the patient is connected, we can, the nurses can guide them or educate them when they are sitting at the home. They can go through some surveys to understand and look into what is the current risk assessment for that patient and then provide the required assistance or the guidance for the patient at home itself. When we are looking into the clinical AI part, so basically, as mentioned in the previous presentation, that the prediction and the recommendations would be available, and identification what can be the better decision from the physician point of view. Those details, when we are having the clinical AI and information is available for those algorithms can execute it on based on those available history data, and the decision would be available for nurses, for physician, and for other institutions. Similarly, we have risk assessment and the compliance part where, or the document intake, where the robot or the intelligent robot are actually capable to extract information and post that information into required area or system. If we look currently, so the hospitals are basically in the second phase of the automation. So we have seen automation, which was the first phase where we have looked into the the administrative and repetitive tasks which were easily automatable through a normal robot. But now we are in that phase where we can see that there is a 60 to 80% of the potential of the automation into the clinical operation space itself. So we are having different systems, nurses, pharmacy, physicians, and care management areas where information need to be gathered, information need to be presented into a summarized manner. Predictions and recommendations can be available for the physicians so that they can take the decision. So basically, currently this second phase is looking into those areas which are by embedding the AI and ML algorithms and presenting those information in a user-friendly manner to the nurse and the physician, we can take the best in-class care for the patients. And to achieve that, there is a quick example of a day from nurse point of view. So if I'm a nurse, I need to take care so many steps in a day-to-day activities for a patient point of view. We need to look how to onboard those patients, look into their insurance, their information gathering and posting into the required EMR or EHR system, then providing day-to-day care, required details or required medicines, required and need to enter all the charges into different system, all those type of activities, and also plan for their checkout or the discharge, and look on all the administrative tasks which are required for that purpose. So basically, all these steps are in the life of the nurses, and how those steps can get help from the digital assistant. So basically, our assistant would be available, which can be available on the desktop. You can navigate, you can start that assistant, you can and you can have multiple type of tasks there: check-in of the patient, validation of the information, check out information gathering, creating alerts for the physician and patient's family. All those type of assistant can be available at the desktop of a nurse, which they can start at any time. Okay, can you go to the 52nd? So here you'll see that this is actually the digital assistant, and I can start it at any time. And I can have multiple type of tasks for me, which can help me from where I can start any. I mean, validation of the patient information, looking into the insurance part, looking into the billing, discharge planning, providing alerts to the different representative, looking into the test result and gathering that information, passing the charging information into the required system or CMR. So all those type of assistant would be available for you. You can start those, or there can also be a push and pull type of solution. So basically, one solution which you will start, and other solution which can monitor your screen, and based on the information on the screen, it can automatically start and push the information which is required for you. And here you can see this is actually an example where a nurse need to send the correspondent letter to the respective patient based on the results from the pathology. Here they were required to go through the system, validate multiple screen, extract the information, copy and paste that information into the letter. But all that task would be done by the robot. Only small information where the correction is required can be done by the nurse through an interface which was previously available. And once that is done, the robot will start and will send the required correspondence to the patient about the test result here. Okay, I think after this we are good for the next step. So this is a small, a quick example from the predictions point of view. So we are having a solution, and this is a solution with a hospital in US where the predictive analytics is basically analyzing if the current patients, what is the probability of this patient to be readmission in the hospital. So going through, the robot is extracting information from a document, and then based on the algorithm which is predicting, okay, what is the threshold of this patient to be readmission into the hospital, and based on that, the physician is actually taking the decision if they need to admit this patient into the hospital or need to discharge or leave from the hospital. Okay, we are good. Thank you.
Okay, thank you, Javed. It's definitely fascinating to see how tech like AI, machine learning, IoT, and all of that can come together to streamline operations in hospitals and to help physicians better treat their patients. At this stage, I would like to invite all our panelists to join us as we head into the discussion segment of this session. Welcome back, panelists. We've heard from both Javed and Dr. Fu on some of the ways that AI are being used in the healthcare sector, but we would love to hear from you as well about the exciting innovations happening in your respective organizations. So maybe starting off with Associate Professor Tan, CHI has been involved in several AI projects over the years. What are some of the ways that you have seen AI being used that you find most exciting, and can you share them with us?
Sure. Firstly, thank you very much for having me on this panel. In CHI, what we do is try to facilitate the advancement of health tech incorporation or adoption into our mainstream practice. And of course, prior to that, it's a lot of development work that our clinicians will have to make, bringing their problem statements forward, working with academia or in industry to co-create solutions. Another route of bringing solutions in is really to assess what's out there in the wider ecosystem, very often in the space of AI with startup companies. And I must say, in the course of work that I have been through with the facilitation of a number of innovation projects, I do see some pockets where AI is particularly more readily taken up. And in the clinical space, this relates to diagnostics. So, for example, with the quantification or automation of some of the more laborious work related to histopathology, looking at microscopic images of the cells that are extracted from patients. That's one example of how AI actually helps to improve the productivity and also the accuracy of our clinical workflow. In the other space of diagnostics, where I'm personally very interested is, of course, medical imaging, and AI has been moving very quickly into radiology images, trying to help us to prioritize the heavy workload on the work list in order to expedite the reporting or the analysis of medical images that are pertinent, for example, in COVID. And in the space of clinical decision support, AI also plays an important role by aggregating the learned experiences from large amounts of data. For example, in our context, helping the clinicians to decide on the most appropriate antimicrobial therapy for infections. Besides the clinical space, actually in the operations, we do see a fair amount of advancement. And in this case, I think we are less bounded by concerns about patient confidentiality. What we do at a system level is to aggregate the information to help us with management of flow within the hospital. So our operations command and control center, really what they look at are ways to optimize the movement or the assignment of beds for patients, optimizing the allocation of beds based on the patient's profiles, as well as some new advances in terms of trying to detect the locations of patients in terms of helping them for wayfinding and also for contact tracing in the context of pandemic. So a wide variety of applications for AI into the hospital system, and I think more to come. Thank you.
Definitely. Thank you for sharing. I think it's really exciting to see how AI is actually applicable to so many different dimensions in the healthcare sector, from treating patients to operations and diagnostics. So maybe moving on to Setyaji, would you maybe like to share as well your inputs on how AI is being used in healthcare institutions in Indonesia to better treat patients or to enhance workflows?
Okay, thank you. Yeah, I think same with the Professor Tan Cheng said before. Actually, we have a few examples how we use the AI for better treat patients and also help our hacker workers in Indonesia. First, some of example. First, we use like some AI for telemedicine. Yeah, we with some startup and some innovators use AI to help diagnosing health issues based on symptoms experienced by its users. Yeah, so use this AI, we can give some recommendations what to do next. Yeah, for users would follow. You have some symptom for COVID-19 or not? It's used for hospital. Yeah, because in the beginning for the COVID-19 pandemic, many people rush to hospital. So we use this for selected people only to go to the hospital. And that's the other things, how we use like wearable device, yeah, with features that can measure like a body temperatures, heart rate, blood oxygen levels, blood pressures, and also some sugar levels, yeah. And the other thing for the stress levels, to know the people's the measures of these parameters, yeah. Most of these features take advantage of AI. And then the other thing is how we provide services to stores and analyze the microscopic specimens using AI and be sent to the hospital or labs. And it's used to help on breast cancer and malaria efforts. And then some of another example is how to help some early detections, yeah, of patient conditions such as saturation, heart rate using the camera phones. Yeah, this is help for the first diagnosis before to continue to diagnosing with the telemedicine. And then the last, how we use the like a chatbot. This is the assistant for users complaint, yeah, for certificates and also for COVID-19 services. Yeah, that's it. Thank you.
Okay, thank you for sharing. It's definitely a lot of exciting use cases there that you've brought up. I think that some of which we'll be exploring further down the road. Now, moving on to Javid, can you share some broad trends of digital transformation happening in the healthcare industry today when it comes to like intelligent automation and digital assistance? How can they benefit patient care and healthcare staff?
Sure. Thank you. So there are multiple examples basically where we have seen we have changed the healthcare services in last 2 years after this pandemic, and when we are embedding the intelligence or the AI ML within the robots, we are coming with the intelligent robotic solutions here. So one of the example I'll give you is basically monitoring the pneumonia and the COVID-19 X-ray. So algorithm is being embedded into the solution, which actually picking the image at the real time. Once the X-ray is available in a specific share folder, it can pick that X-ray from there, and based on the algorithm execution, it can predict what is it. Is it a pneumonia patient, or what is the percentage of that, and also the COVID-19. This is one example. And then another example I would say, so by utilizing our process mining solution, which can look into the historical trends, historical data, and come up with some trends. So there was a very good use case on the optimization of the operation theater, how the optimization can be improved. So basically, let's say when we are using the OR, we are having specific time. So let's say a type of surgery is being taken 1 hour and other is being taken by 2 hours. The operation theater is booked for that period. Now, by using that optimization solution and coming up with the recommendation, we have seen around 30% of the optimization of the operation theater. So basically, now more and more surgeries can be done, and a better outcome for the patient as well as for the hospitals can be achieved by that optimization. Other than this, so basically, if we look into the discharge part, so now when we are normally doing the discharge, so sometime we are actually delaying. So by utilizing intelligent solution which can monitor each and every stage of the treatment, can come up with the predictions that this can be a probable time for the patient to discharge, and also can communicate with every representative or the stakeholder of the complete treatment, so nurses, physician, representative from the patient side. So if we can communicate with them and all or the test labs so that the results are available quickly. So this complete end-to-end solution is being targeted by the robots and the embedded AI/ML. And now we are again able to bring 20 to 40% of the improvement there by discharging the patient and then again utilizing the hospital resources to bring more treatment for the more patients. Other than this, there is another important point to share, that care coordination. So basically, when we know that there are some patients which are on high risk, we can communicate with them, and then through some questionnaires we can come up with some answer, and based on those answers we can have the algorithm which can predict what is the current status of the health and how this health can be improved. Are they need any readmission this time or maybe in future, or we can, all those type of readmission can be avoided by monitoring those patients at home through care coordination from the hospital itself.
Thank you, Javed. So I think we have all the panelists there have brought up really good use cases and points about how AI is used in telemedicine and wearable devices, and all of that I think reminds me of a pertinent problem that many developed nations face, which is the aging population. And with that comes an increased risk of chronic diseases. And I think it'll be useful to see how AI can be used in the form of telemedicine or wearable devices to actually tackle this problem. So on that note, I'd like to direct this next question to Dr. Fu. Perhaps you could shed some light, I think, on how AI can be used in these ways to perhaps manage the healthcare concerns that comes with an aging population. I know you've really talked about the chronic kidney disease earlier, so maybe you could expand a little bit on that.
Hi. Yes, AI can be used as a decision support tool to improve the patient care. As I just showed that it can actually help for the chronic disease management. And AI can also help to reduce manpower, as many of as other speakers has already mentioned that the AI can help by go through the, for example, the medical image, like X-rays image or the microscopic image. And this can save the manpower. And for in AIxGov, we actually have projects using natural language processing, NLP, to save the manpower using the AI to read the clinical notes. I think this is the areas that I think AI can help for the healthcare staff to reduce the manpower. Yeah.
Okay, thank you very much, Dr. Fu. I think we've talked a lot about like the exciting innovations happening and all the benefits of AI. Kind of moving on into the challenges at this stage. Associate Professor Tan, could you maybe share from your experience of working with AI and implementing AI solutions in healthcare? What are some of the common challenges faced in the development and implementation of AI, and how can healthcare institutions overcome these challenges?
Yeah, thanks, Ming-En. A very practical question, actually. And I lament that the rate at which we adopt AI into clinical practice is still relatively slow. And I think as a country, as a health system, Singapore is very well positioned to incorporate the advantages of AI into our practice and mainstream practice specifically, because most of the hospital systems are digitally connected and perhaps interconnected in some ways. In regards to the development of AI, I think the issues surrounding data confidentiality, the management of data becomes particularly important for us as a health system. And the next step, the next challenge in the product development cycle is really the commercialization. And I say this because most of us clinicians are not very attuned to the entire journey of bringing a solution from prototyping all the way to a product. And there are multiple hurdles to clear, particularly regulatory hurdles that we need to be mindful of. And some support that I've seen being given, even personally to my own project, has been through collaborators such as from A-Star, DXD Hub, where they have a team that is specifically looking at the supporting the productization journey. I think the other major challenge for us is really about how we adopt and implement the AI solutions into our mainframe, and we in some ways perhaps being very advanced in the way we have digitalized the health system actually sets us back a little bit, because there are large enterprise systems that we have to be dealing with. So the integration of new AI solutions, particularly from the smaller startup companies, can be a huge challenge for us. And there are multiple policies and hurdles that we have to circumnavigate in order for us to effectively deploy these solutions into our practice. So those are, I would say, the two very large issues and challenges that I think anybody who wants to embark on developing as well as adopting AI need to be mindful of.
Okay, thank you for sharing. And on that note, I would like to direct my next question to Setyaji. What are some of the limitations that come with using AI on top of the challenges that Prof. Tan has already mentioned? For example, if there are inaccuracies or biasness in the AI, could you maybe share a little bit more about those limitations and how healthcare institutions can overcome them or manage them?
Yeah, okay. AI success is very much dependent on correct understanding of the problem, and also its data and algorithm use. The correct understanding of the problem will create the approach which carefully selects the data inputs. It can be biased because of the data use. It can produce good results if the data set as the base of its processing are high quality data. Also, if we throw bad data to the mix, it will produce the bad results. So I mean, good data is good decisions, bad data is bad decisions. Then it comes to algorithm that process them. How we select the algorithms and its tools learning will make the AI solution successful or unsuccessful. First, the healthcare organization must understand the problem domain they want to solve and consider also there are possibilities the data are not 100% correct. All the algorithm is correct. They will have to adjust based on the results, and step by step will take them into the correct output they expect.
Okay, thanks for sharing. And then I think moving on to Javed, from the limitations and the challenges that both Prof. Tan and Setyaji have shared, what do you believe are some of the considerations that healthcare institutions should have in mind as they pursue innovation, as they develop AI programs or automation to improve their work and improve how they treat patients, sorry. Sorry, I think you're on mute.
Yeah, I was on mute. Sorry. So my co-panelist has explained, I mean, what are the limitations and what are the challenges here. So to take those points to next level. So whenever we are actually designing a solution or we are looking to design a solution, first of all, we need for sure a problem. What is exactly the problem which we are going to solve? And what are the dependencies for that? So basically, to solve a problem, we need different systems. What are those systems which are going to be involved within the solutions? How the data would be available? The historical data for the training point of view, as well as the real-time data. So from historical data, we would be able to design a solution. At the real-time information and execution, we would be able to take the benefit of that solution. So basically, identifying a problem, looking into the different resources which are going to be involved, applications and other resources. And in case of the involvement of multiple systems or the siloed data, how we would be able to aggregate that information. And then what are the other resources from the technical aspect point of view, from a skilled people point of view to solve that, to design those algorithms, and then how that algorithm would be executed. So let's say, example is from from a UiPath point of view, I'm just trying to correlate this with the UiPath. So we are having the end-to-end platform where we are having the simple robot can be executed. We are having our process mining, which can actually go into the process and actually mine your process for past information and come up with the recommendation. We are having our AI center, which is actually can be utilized once you are having your algorithm ready. You can deploy that algorithm and that execution can be done. And also, as earlier mentioned, that current, we are having current level of information and we designed a solution, but it may be that after 1 year or few months we might require some changes. How we would be able to retrain that algorithm, or how quickly that algorithm by retraining would be available again to utilize, right? And then for physician or for nurses, whatever the algorithm or solutions we have designed and deployed, how the benefit would become for them. So basically, for telehealth point of view, from discharge point of view, from resource management point of view, how that outcome would be available or presented to our nurses and physicians in a user-friendly manner. So all those things need to be looked, and based on all these identification, and finally we will be coming up with a conclusion. Okay, for this is our problem, these are the resources which would be required, this is the way we can design the solution, and like this way we can execute it. So basically, all these are the pointers which we need to monitor, we need to follow, and based on that we need to design and execute our solution.
Thank you, Javed. I think that gives a pretty good insight into what clinicians or even those in healthcare innovation can consider when they're developing AI and health tech products. I think moving on to Dr. Fu, all your fellow panelists have shared kind of the challenges, the limitations. In your experience working in IHIS and with AI, what is some advice that you would give to healthcare organizations who are looking to integrate AI into their systems?
Yeah, sure. I think healthcare organizations in Singapore are very active in adopting AI solution, and they like to develop their own models and tools. Sometimes they buy off-the-shelf products. I would suggest that they consider more about how these tools can be integrated to their entire workflow. As Java just mentioned that, right? To map out the detailed workflow, because in many cases where I have experience with, they have not thought deep enough how the AI tool will be used and how it will be integrated with the rest of components. I think this is very important that I will suggest those users to think deep into this area. Yes.
Okay. I think one last question when it comes to kind of challenges and advice. This one's for Satyajit. We've spoken, I think both Prof. Tan and Dr. Fu has provided kind of an insight into the health landscape in Singapore and how AI is being used. Could you perhaps share some challenges that you feel might be unique to Indonesia and how Indonesian healthcare institutes can overcome them to integrate AI into their systems?
Yeah, me first. Yeah, okay. Yeah, actually, the first is about the infrastructures. Yeah, the infrastructure. I mean the internet connections and also the talent itself. The digital literacy and also the knowledge about the capacity of the using of the technology itself. And then the last thing is about the data itself. So actually now we have some strategy to make this standardized for the data, and then also upgrading the capacity of its health workers in its facility, especially in the primary care. And then the last to improve the capacity of infrastructures in the especially in the remote area. Yeah, that's it.
Okay, would you like to expand maybe a little bit on some of these initiatives that are being used to improve the capacity and standardize the data sets?
Yeah, we have the roadmap in our blueprint of the digital strategy in Indonesia. what of our plan is in this year, we want to upgrade the capacity of the data analytics, and also the talents of using the AI and using the technology. We need to upgrade more than 10,000 our talents in the health facility.
Okay, that definitely sounds very exciting. And I think on that note, it's a good time to transition into what we're talking about next, which is kind of what the future of AI would be like in healthcare. And I think Prof. Tan mentioned earlier on that there are some segments in healthcare where AI is more readily taken up than others. So I think this goes out to all the panelists. What do you think are some of the new possibilities of using AI in healthcare that has yet to be explored? And can you maybe share one or two AI use cases that you're excited to see in healthcare in the near future? So maybe starting with Professor Tan.
Yeah, sure. Thank you. So we have covered quite a broad range of possibilities, and I think for me personally, what could be more readily implemented and maybe taking some lessons learned from the COVID pandemic is in the realm of flow management, and more specifically with the use of video analytics. And here is where it gets really exciting yet challenging, because as I mentioned earlier, data privacy is a prime concern for us. But suppose we are able to, through the use of video analytics, map out the flow of patients across the hospital, we can then be more adaptable in the setting of a sudden surge in the pandemic or a sudden outbreak, and our response as a hospital will be more resilient. And therefore, I think that is one domain that I think AI could be quite soon implemented, and at the same time prepare us for the future. Thank you.
Thank you. Javed, moving on to you next.
Okay, so from my experience point of view for last around 10 years, so I can say that first of all, the healthcare, the hospital in the healthcare are the late adapter of these advanced technologies. So I would say, we have seen a huge improvement in the adoption of these advanced technology in the last 2 years. After COVID pandemic, we have realized what are the different capabilities or different advanced solutions which can be helpful for providing a best care for the patient. And when we are looking at it day by day, each day we are learning something, and we are trying to utilize that learning into the intelligent solutions to provide the best treatment for the patient. Now, as mentioned, the video analysis would be one area, but because of the compliance and data securities point of view, right now there is some limitations, but yeah, in future we would be. Other than that, we have seen that the lab results, it can be any image or it can be any other type of results, how the information can be extracted from the documents, and that information can be executed through AI/ML algorithm, as well as so how quickly those results would be available from the lab output to a algorithm or to a solution which can execute and can come up with the results. Those are the areas to focus. And there is a one very interesting use case to discuss. Basically, we have seen in one of the geography where when patient was admitted into the hospital, they were giving some tentative cost of the treatment when the person is not having the insurance or maybe a limited insurance there. So let's say somebody was saying that, okay, X amount of cost would be there for this treatment. And when the patient was discharged, at that time, that cost was not matching. And there were concern from the patient side as well as from the hospital side, because they were not able to pay properly and so many things. To solve that problem, so we help the hospital actually, and still we are helping because it is gradually a learning process where we would be able to solve this problem in a long term. But yes, so basically looking into the past information, gathering all those information from different areas, formatting that information, and then coming up with a predictive model which can, whenever some patient is providing some of the information is being fed to the system, it can predict what can be a tentative treatment cost with a threshold plus and minus, so that the person, the administrative who was actually taking patient in, they can provide that detail to the relatives, and then at the final stage of the discharge, that would not be, problem would not be there. As well as there was a immediate mediator step where in case there is any fluctuation within the outcome which was come initially, then there can be alert to the administrative as well as the patient family, so that the future conflict can be avoided. This is something, like this, there are so many other stories which are actually being executed or are in progress, would be executed in future from hospital's point of view. Thank you.
Thank you for sharing. I think that definitely sounds exciting, and how that would impact healthcare, I think, would be interesting to see in the years to come. So moving on to Dr. Fu next, what is kind of an AI technology or AI use case that you're excited to see in the future that you think would be really helpful for the healthcare sector?
Yes, we are currently helping healthcare providers such as doctors, nurses, healthcare providers. But I think we can use AI to help patients directly, so that the patients can go to AI instead of doctors. It will be quite challenging because patients like to go to the doctors and see the real patient, see the real person. But I would like to see the application in this area, because I will see that this is the real future, that the AI becomes a real intelligent, that can replace some of the real intelligent people in this world. So this is the area that I'm hoping that can have some advance in the future. Yes. Thank you very much.
That definitely sounds exciting, and that I think that sums it up to kind of the title of this panel, which is AI as the new clinic assistant. If it can eventually take on some of the roles of the clinicians and help our clinicians work better, I think that would definitely benefit the healthcare sector as well. So last but not least, going to you, Satyaji, what is something that you're excited to see in the AI space in healthcare in the coming years?
Yeah, I think the AI you said on to prevent the outbreaks. Actually, we have COVID-19 pandemics, and also several pandemics and or endemics. Based on these various patterns and learning, we hope it will make us aware of any situation which can lead into outbreaks. So we can forecast it, make a necessary preparation, and would prevent before it happens. And the other side, we are working towards precision medicine. It will be based on genome sequencing data that have already been collected by various research centers in Indonesia. Yeah, we have the data. We know what we are looking after. By employing AI approach, we hope to find a better medicine precisely for Indonesian people, and the capability to do this by Indonesians. Thank you.
Okay, thank you very much for sharing. And I think that's about all the time we have for today for this session. Once again, I want to thank all our panelists for sharing their insights, and to all our viewers from home or wherever you are for joining us here today. I think we've had an interesting and fascinating discussion on how healthcare institutions are using AI to treat patients, to improve operational flow, and how they can overcome challenges to integrate even more AI, and what we can expect to see from health tech in the coming years. So after this session, do stay tuned for our final session of the day, which will be the future of AI in government, starting at 4:45 p.m. The session will give you a glimpse into what the future of an AI-driven government will look like, explore the strategies and challenges to get there. So really exciting stuff. Once again, thank you all for joining us here today, and I hope you have a wonderful day ahead.